Hello everyone. Let's discuss about tetany. What is tetany? Tetany, it is a clinical condition causing neuromuscular irritability and involuntary contraction of muscles. What are the causes of this clinical condition? First is hypocalcemia. Whenever there is fall in the plasma calcium, it can cause tetany. How? How does it cause tetany? Because the cell membrane of neurons becomes more permeable to sodium whenever there is hypocalcemia. Whenever the permeability to calcium is increased, there can be hyperexcitability of cell membrane, paresthesia, and muscular spasm. Next factor is alkalosis. High pH, it causes ionization of proteins. And these ionized proteins, they bind with the ionic calcium. So even if the total calcium is normal, free calcium gets reduced and tetany sets in. Okay, so alkalosis, very important point that can cause tetany. Hypomagnesemia, it can cause neuromuscular irritation. Then hyperphosphatemia. Increased phosphate, it can also elicit muscle spasms. Okay. Reduction in the functioning of parathyroid gland can cause hypocalcemia. Hyperventilation induced hypocalcemia, very important. Hyperventilation. It can contribute to tetany. How? By causing washout of carbon dioxide and producing alkalosis. Alkalosis, it will set in tetany. Okay. Clostridium tetani. It is a bacteria that causes pathological tetanus, not tetany. That is how you will have to differentiate between tetany and tetanus. Tetanus, it is caused by Clostridium tetani, pathological tetanus. Okay, by inhibition of GABAergic and glycine mediated neurotransmission, produces lockjaw. So we will focus on tetany here. Okay, clinical features, they depend upon the age. In children, the features are different. In adults, the features are different. How these are different? In children, we will see carpopedal spasm. Spasm in the muscles of hands and feet. You can see a peculiar picture of carpopedal spasm here. Okay. Spasmodic contraction of muscles of hand and feet, specifically wrist and ankle. So we'll see that there is flexion at the level of wrist, that is at metacarpophalangeal joint, and extension of fingers, that is at interphalangeal joint, along with opposition of thumb. Again, I'm repeating, I talked in the previous lecture also, obstetrician's hand, obstetric hand. Okay, it gives a peculiar shape to hand. If we talk about foot, there is extension at ankle joints and flexion at the level of fingers. So fingers, they get plantar flexed and extension at ankle joints. We can observe laryngospasm. Spasm of the laryngeal muscles produce a loud voice known as laryngeal stridor. Okay, that may also result in asphyxia. And as a result of asphyxia, convulsions can also occur. We can observe excessive sweating, spasm of intestinal, gallbladder, muscles of respiration as a result of autonomic excitability. Okay. Death can also occur because of asphyxia. But in adults, features are slightly different. There is occurrence of paresthesia. What is the meaning of paresthesia? There is tingling sensation in the extremities and perioral region of the face. Along with paresthesia, there is occurrence of carpopedal spasm, laryngospasm, but convulsions, these are less frequent in adults. There are two signs to diagnose latent or subclinical tetany. First sign is Chavostic sign, next is the Trausius sign. What does the signs means? Chavostic sign, on tapping at the angle of the jaw over the facial muscle, ipsilateral facial muscle contraction is observed. So on the same side, there will be contraction over the facial muscles on the side we are tapping. That means that there is abnormal reaction towards stimulation of facial nerve, and that is a sign of hyperexcitability of nerve in hypocalcemia that we talked about in the causes. Next sign is the Trausius sign. What does it mean? In this, The circulation of blood of the forearm, it is occluded by applying the blood pressure cuff. अप्लाई करेंगे बीपी कफ, ब्लड सप्लाई को ऑक्लूड करेंगे टिल 3 minutes. Because of this, there is flexion at the level of wrist and extension of fingers and opposition of thumb. That means we can get carpopedal spasm. That is how we diagnose latent tetany or subclinical tetany. Okay, so these two signs are very, very important. How we can treat the condition? Giving activated vitamin D or calcitriol, giving calcium supplements, and in severe cases, IV calcium gluconate, it can also be given. So thank you so much. It was all about tetany. Thank you.